All right, here we go. This is TPLO pack?
Yeah.
All right, recording again.
This is the TPLO pack. If you have space on your table, you can place it up here. Many times when everything's getting thrown up all at once, you might not. So as long as it's a large dog, you can set it right here on their belly and unpack everything. The TPLO pack has all of the sort of random instruments that you're going to use. These from the large and small pins. Lots of these sharper things have these rubber stoppers on the end. Immediately just take those off and toss them in the tray. The other thing I will do with Dr. Roach is you're only going to need one large pin, one small pin. Go ahead and toss the other two in the tray. You won't need those. And then all these random instruments such as your hammer, your AO, your osteo elevator. Just line up everything here. Again, here is the rubber stopper. Take that off in the tray. This is the TPLO jig and the TPLO jig pin, which is not used most of the time with Dr. Roach, so I just toss it in the tray. The osteotome, your Wallace retractor. Usually place the Wallace retractor and the compass or whatever that thing is right there in the middle of the table, and your bending irons are placed on the surgeon side of the table in the tray where they can easily access those to bend a plate. And then every TPLO pack has both right and left TPLO plates in it. So obviously that point sort of goes towards the cranial side of the dog. So this is the right TPLO blade or plate. I just toss the left one up in the tray to keep it clean. I'll save one of the blue towels out of this pack so that I can put the chucks on the drills without tearing my gloves after a while. The chucks are always thrown up like this. You should get two of them. Chuck keys. All the drills are double wrapped, so she unwrapped the outer wrap and handed this off to me. There's a green drill. And another green drill. So ideally, we have two different types of drills here in NVS. We have these old green Makitas, and then we have a newer white one. The white one just has a higher RPM on them and spin a little faster, maybe better for drilling holes and bones. So I take the Jacob's chuck in a blue towel, and as long as it's on the forward function, hold the chuck and it'll tighten itself down on the drill. Same thing. And this is the frag set, which means the screwdriver, the screws, the depth gauges, all of those things that we'll use. So I put the screw rack up here on the side of the table of the dog's leg we're doing, which is the assistant side, because the assistant's going to be the one getting the screws, handing them off to the surgeon, measuring the screws. The depth gauge, I just put in the lineup right here with all the other instruments. And then the drill guides, I just put at the back of the table, not regularly used during a TPLO, but they could be. In this pack, there are two quick connects. The quick connects are used to put in the end of the Jacob's chucks, and you can easily swap in and out screws and drill bits. The quick connects are not used by Dr. Roach. Dr. Calfee demands the quick connects. The advantage of the quick connects is, well, there is no advantage to the quick connects. The disadvantage is that it makes your drill and everything a lot longer, and it's almost impossible not to have your drill bit be wobbly. drills and the taps come in this nice little handy pouch. So for TPLO, they're written on here what size drill bits and taps are here. You'll need a 2.0 drill bit, a 2.5 drill bit. So I always pull both of them out. I look at the ends of them, say, okay, that's the sharp one. I put the dull one back in the pack, trying to make life easy on your surgeon. That's the dull one, sharp one out. And then you'll need 2 taps, the 3.5 cortical tap and the 4.0 cancellous tap. And these aren't quite so important. You can't hardly tell which ones are going to do better or worse. Sometimes you can if they're very rested. I fold up the drill bits and taps and just put them back behind the screws and get them out of the way. And here's our large pin cutter. It's also a double wrapped instrument. Now, for Dr. Roach's surgeries, you'll be cutting the large pin in half. So put that there, place one arm of the pin cutters in your tabs of steel, pull firmly, and then it's not going to break all the way. Just give it a couple twists and it'll break off. And there's a threaded end of the pin and a non-threaded end of the pin. Toss the non-threaded one in the basket. You're not going to need it. So now you got a small pin and a threaded pin. Your pin cutters can just go up in the tray. You're probably not going to need those for a while. And you can load your drills up with your 2 pins because that's the first thing you're going to need throughout surgery. Now, if you have the ideal situation where you have a green drill and a white drill, the smaller pin always goes in the green drill because it's easier to drive than the larger pin, and put the larger pin in the white drill.